morning habits can protect your heart for years, but unhealthy morning routines can quietly increase your blood pressure, worsen cholesterol levels, damage blood vessels, and raise the risk of heart attack and stroke without you even realizing it. And in today's detailed discussion, I want to explain 5 very common morning habits that many people follow daily which may secretly harm their cardiovascular health over time. Because most patients think heart disease develops suddenly, but in reality, it builds slowly through repeated lifestyle patterns that affect stress hormones, circulation, metabolism, inflammation, sleep quality, and arterial function. And the first habit that can raise blood pressure and cholesterol is immediately checking your phone after waking up, because the moment you open stressful messages, work emails, social media arguments, or alarming news, your body releases stress hormones like cortisol and adrenaline, which naturally increase heart rate and blood pressure. And when this happens every single morning, the body remains in a chronic stress state that contributes to hypertension, anxiety, poor sleep recovery, increased inflammation, and unhealthy eating behaviors throughout the day. And many people don't realize that their heart is being stressed before they even leave the bed. And the second harmful morning habit is skipping breakfast or delaying food for too long while consuming only tea or coffee, because when the body stays without proper nutrition after waking, blood sugar fluctuations and stress hormones rise, causing cravings, overeating later, poor metabolism, and increased cholesterol production. Especially when people later compensate with processed foods, fried snacks, or sugary drinks. And many studies suggest that balanced breakfasts containing protein, fiber, fruits, nuts, and healthy fats may help stabilize blood pressure, improve cholesterol levels, and support long-term heart health. And the third dangerous habit is starting the day with sugary beverages or highly processed breakfast foods like sweet cereals, bakery products, packaged juices, sugary tea, cream-loaded coffee drinks, or fast food breakfasts, because these foods create sudden sugar spikes and insulin surges which contribute to weight gain, inflammation, fatty liver changes, diabetes risk, and elevated triglycerides. And over months and years, these metabolic disturbances significantly increase cardiovascular risk, especially in individuals already suffering from hypertension, obesity, or borderline cholesterol issues. And many people assume breakfast foods marketed as healthy are actually filled with hidden sugar, salt, and unhealthy fats that burden the heart. And the fourth morning habit that harms cardiovascular health is avoiding physical movement after waking, because prolonged inactivity reduces circulation, increases stiffness in blood vessels, slows metabolism, and contributes to poor blood sugar control. While even light morning movement like stretching, walking, breathing exercises, or short exercise sessions can improve blood flow, lower stress hormones, enhance oxygen delivery, support weight management, and improve overall heart function. And many patients tell me they feel tired in the morning and avoid movement completely. But gentle activity often increases energy naturally while benefiting blood pressure and cholesterol control. And the fifth harmful habit is consuming excessive salt early in the day. Through packaged breakfast foods, processed meats, instant snacks, chips, sauces, pickles, or restaurant breakfasts, because sodium causes water retention and increases pressure inside blood vessels, forcing the heart to work harder. And over time this can worsen hypertension, heart enlargement, kidney strain, and arterial damage, especially in people genetically prone to high blood pressure. And unfortunately, many breakfast items that taste normal actually contain very high sodium levels hidden inside processed ingredients. And beyond these 5 habits, I also want viewers to understand that sleep quality plays a major role in morning cardiovascular health, because people who sleep late, wake up exhausted, rely on stimulants, and rush through stressful mornings are more likely to experience persistent hormonal imbalance and elevated blood pressure patterns throughout the day. And one of the best strategies for protecting your heart is creating a calm, structured, and balanced morning routine that supports recovery instead of stress. And this includes waking up at a consistent time, hydrating properly, exposing yourself to natural sunlight, practicing deep breathing, eating balanced meals, avoiding emotional stress triggers, limiting processed foods, and gradually incorporating regular movement into your daily life. And it is also extremely important to monitor blood pressure regularly because hypertension often develops silently without obvious symptoms, and many individuals discover their blood pressure is dangerously high only after a heart attack, stroke, kidney issue, or emergency hospitalization, and similarly cholesterol problems can remain unnoticed for years while fatty deposits slowly narrow arteries supplying the heart and brain, which is why routine health checkups, lipid testing, blood sugar monitoring, weight management, and lifestyle correction are essential for prevention. And I also want to emphasize that improving heart health does not require extreme diets or sudden dramatic changes because small consistent improvements in your morning habits can create major long-term cardiovascular benefits, and patients who reduce processed food intake, improve sleep timing, manage stress better, increase physical activity, and eat more natural whole foods often see significant improvements in blood pressure, cholesterol levels, energy, sleep quality, and overall well-being within months. And another very important factor is hydration. Because many people wake up dehydrated after several hours of sleep and immediately consume caffeine without drinking water first, which can temporarily worsen palpitations, headaches, and blood pressure fluctuations. While proper hydration supports circulation and helps the body function more efficiently, and for people already diagnosed with hypertension, diabetes, obesity, or heart disease, maintaining disciplined morning routines becomes even more critical because unhealthy morning patterns can accelerate disease progression and increase the risk of complications. And if you frequently experience symptoms like morning headaches, dizziness, chest discomfort, unusual fatigue, palpitations, swelling, or breathlessness, you should not ignore them and should seek proper medical evaluation. Because early detection and prevention remain the strongest tools in cardiology, and ultimately your morning routine sets the tone for your entire cardiovascular system throughout the day, and small unhealthy habits repeated daily can silently weaken the heart over time, but healthier choices made consistently can protect your arteries, improve circulation, reduce inflammation, stabilize blood pressure, lower cholesterol, and help you live a longer and healthier life.